welcome back. So I wanted to pick up with chart 2, right? So computerized axial tomography. This is also known as a CT scan. It can be called a CAT scan as well. A CT scan can really be used on anything like electronics. It can be used on the body. It can be used to scan anything, right? But computerized axial tomography is specifically what we do with humans. So I have a video, because we love videos, regarding what a CT scan is and how it works.
A CT scan is an X-ray procedure that creates cross-sectional images with the help of computer processing. CT images are more detailed than conventional X-ray images and can reveal bones as well as soft tissue and organs. A conventional X-ray uses a fixed tube that sends X-rays in only one direction, while a CT scanner uses a motorized X-ray source that shoots narrow beams of X-rays as it rotates around the patient. There are special digital X-ray detectors located directly opposite the X-ray source. As the X-ray passes through the patient, they are picked up by the detectors and transmitted to a computer. Image slices can either be displayed individually in two-dimensional form or stacked together to generate a three-dimensional image that can reveal abnormal structures or help the physician plan and monitor treatments.
Okay. So that's a CT scan. Pretty cool. It's basically like a more definitive X-ray. Gives a better picture. Okay. Cath, this is for catheter or to catheterize. We use catheters a lot in medicine. All a catheter means is it's a tube. It's like a straw, right? A tube. It's hollow in the center. So a couple pictures of catheters. So these right here are urinary catheters, right? And they go into the body, and then we use this end here to blow up this balloon, right? So this isn't actually blown up until after it's inserted into the urethra and gotten where it needs to go. We use urinary catheters for patients that are bed confined that can't get up to use the bathroom. We use urinary catheters for patients that are going in for surgical procedures, that kind of thing, where they may need to use the bathroom, but they're not going to be able to get up to actually use one. So that's what we use urinary catheters for. Now, this is an example of an IV catheter. So this is an IV needle. This is actually a model that we use on an ambulance. So this blue part controls the actual catheter. So we have to use a needle in order to penetrate the skin to go inside of the vein, because we use an IV needle for intravenous, which means we go into the vein for blood draws, for injections, fluid control, that kind of thing. So even though this tip here is a beveled needle, starting about here, this is a catheter, so it's a tube. So they don't leave the needle inside of you when they start an IV. What they do is they penetrate your skin with a needle, and then they press this little button here, and it pops the needle back inside of this plastic case. So then it's also safe, so you don't have an active, needle sharp potentially that could stick people. But they leave this catheter right here. It's a little plastic tube. Okay. All right. So catheterize. That's C-A-T-H with a capital C. Okay. CBC, this is a complete blood count. So this is a series of tests they can run on your blood that gives you the total number of, like, say, white blood cells, red blood cells, like all the different cells that are inside of your blood. It counts them. Okay. CBET, this is a certified biomedical equipment technician. So we learned this in chapter 3. And these are the people that are trained to work on the medical equipment, right? So the CT scans, the heart-lung machine for heart surgeries. Okay, they're the ones that are specialized and trained. I have a friend that does this at McLaren and Flint, and he's actually on standby during surgeries just in case that equipment has any sort of malfunction during the surgery so that he could be there just to monitor and fix it if need be. They make good money. Generally take associates to a bachelor's level of training, and some places I've actually heard will hire and train as long as you have some mechanical knowledge, which is pretty cool. CBR, this is all caps, complete bed rest. Okay, so say if you have like a femur fracture or hip fracture, where if you were to get up and walk around or put weight on it, you would actually re-injure the area if you even slightly stood up or sat up in bed, something like that. This is generally where you need to lay down in a bed all the time, right? And move as little as possible. It's not comfortable. And generally they don't do this except for extreme circumstances. But it's very important, especially for elderly patients, that if they break something important like a hip or a femur, which is your thigh bone in the top part of your leg, that you're able to heal it properly. Because if it doesn't heal properly, you're always going to have issues with it. Okay, so complete bed rest is ultimately very extreme, where you're bed confined due to some sort of condition. Now, this abbreviation is not star CC. It's literally just CC. The star is there just to show you that it's lowercase. Okay. So cubic centimeter. This is a unit of volume. So a centimeter we know is length. If something is cubed, it's three-dimensional, which means that we can measure volume with it because it is three-dimensional. A cubic centimeter is the equivalent of a milliliter. It's the equivalent, it's the equivalent of milliliter. So we generally draw up our syringes and we measure it in cc's or milliliters because we have to know how many, what the measurement of liquid we have to give the patient is, whether it's a medication or a fluid, anything like that. We need to know a specific measurement. And cubic centimeter, or also known as milliliter, is the base measurement for fluid. Capital C, this is for a chief complaint. Chief complaint. This is how they do medical billing. And they look at what the patient is actually going in to be seen for. That's their chief complaint. Is it necessarily what they get treated for? Probably not. Sometimes yes. So if you have a patient, you could have a patient that has multiple complaints. They go into the emergency room and they may say, my stomach is hurting and my toe hurts, right? So the chief complaint is not going to be necessarily what you deem to be the most urgent issue, but it's what is the most concerning to the patient. It is the patient's chief complaint, okay? What is the most important complaint to them? All right. Do they think their toe is the more important chief complaint, or do they think the abdomen would be their chief complaint? All right. And then any other complaint that's not the chief complaint, those are also considered complaints, but they're not the chief complaint. Okay. All right. CCU, it's all capitals. It has two different meanings. Potentially have two different meanings. So it could be a coronary care unit, which is generally what houses cardiac patients that need more specific care, but it's not bad enough to where they need to be in an ICU or an intensive care unit. Okay. Same thing with critical care unit. So these take on the patients that maybe they need more attention from a nurse than say on a normal hospital floor, but they're not quite to the extent where they need an ICU. And so it's kind of that middle ground there. CCU. CDA, this is Certified Dental Assistant. This is the individual that assists the dentist with procedures. They do not provide direct patient care with dentistry, but they do assist the dentist, and they can also be trained to take x-rays as well. Okay, this is an example of an HS HSCE program. Okay. CDC, this is the Centers for Disease Control and Prevention. Okay, so even though it just has 3 letters, it means Centers for Disease Control and Prevention. Okay, this is located in Atlanta, Georgia, and they focus on, what research for what diseases are, how do they reproduce, how do they spread, how do we contain them, how do we kill them. Okay, so they actually they can maintain bacteria and viruses just in case one of them emerges and they need to come up with, say, a vaccine or a treatment. Sometimes the equipment that we had 20 or 30 years ago is not enough to do much with these bacteria and viruses, but maybe now or sometime in the future. So they do a lot of research. They hire a lot of biologists, a lot of physicians that do research, that kind of thing. And they are one of the leading world specialists in pathogens, which are disease-causing organisms. We have a CEO. This is a chief executive officer. Generally, when a company is publicly owned where they have stock shares in their company, they are generally run by a group of people, and the person in charge of the whole shebang is the chief executive officer, the CEO. Okay, it's all capitals. CF, okay, cystic fibrosis. Now, okay, so I found this cystic fibrosis video, and it does a really great job of explaining what cystic fibrosis is and how it affects
the
people.
body's exuberant response to something that's actually harmless, and really anything that the body.
Hang on. How did that work? Oh, because I clicked on that. Sorry. There we go. Now I can do full screen.
As babies, these brothers were diagnosed with cystic fibrosis.
While they seem healthy on the inside doesn't show that same story, so it's scary. Cystic fibrosis is a fatal progressive genetic disease. The life expectancy is 36 years. So I was faced with the reality of I have 2 children with CF that I will probably outlive.
Children with cystic fibrosis need daily treatment. Luckily, Katie found the Mortgage Academy at National Jewish Health.
For him to go to a normal elementary school, I was very terrified because I just didn't think that he would get the care that he needs. Neither of them. Here, the nurses listen to them. They hear what's going on with them. They sense when something's off.
First thing in the morning, we do the vest therapy. The vest therapy is used to vibrate the chest and lungs in order to lessen the congestion, which makes it easier for them to breathe. Carrie and Malik are absolutely beautiful boys, and it's a wonderful thing knowing that we are doing our part to keep them healthy. This allows kids to be kids, and that's very important to their development.
With a new drug and ongoing research, the future holds great promise for cystic fibrosis patients around the globe.
We here at National Jewish are a part of the largest cystic fibrosis program in the nation. We are a leader in clinical research, which will help improve the course of our patients' lives and improve their survival.
Being here, I truly feel full on their lives. They can grow, they can mature. The sky's the limit.
Okay. So cystic fibrosis, unfortunately, is kind of a death sentence, and it's a genetic thing. And there's actually now gene therapy for cystic fibrosis, which is a great thing. Anyways, moving on. CHD, this is coronary heart disease. This is where you have some sort of problem with the blood supply of the heart. The blood supply to the heart, like the coronary arteries, are called coronary because it supplies blood to the heart. You have coronary veins that bring that blood supply away. And this isn't where you have heart disease all throughout the heart. It's just the supply to the heart itself. The heart muscle is somehow diminished or abnormal in some way. CHF, this is fairly common, congestive heart failure. So with congestive heart failure, this is where your heart begins to fail, okay? Either it's the left side or the right side of your heart, okay? All right, and if you look at the anatomy of the heart, okay, if you have one side of the heart that's not working as hard, right, it just can't, okay, if it can't push out the blood that needs to come in, okay, on the right-hand side of the heart, your vena cava, the superior and inferior vena cava, bring the blood back from the rest of the body. And it goes into the heart, right, into the atrium, into the right ventricle, and it gets pumped out to the lungs. So if you have right-sided heart failure, it's going to wind up backing up fluid into the rest of the body. This is where you get systemic edema, which is where it's an excessive amount of fluid in your tissues, and it causes swelling. So generally, if people have to wear compression stockings or compression socks because their feet or their legs swell up a lot throughout the day, that may be an indicator of right-sided heart failure. Then you have left-sided congestive heart failure. Now, we talked about how the body sends the blood to the right side of the heart and it pumps it out through the pulmonary artery to the lungs. Well, after it goes through the lungs, it comes back through the pulmonary vein into the left atrium to go into the left ventricle and out through the aorta to the rest of the body. So if it can't push out enough blood to the rest of the body, it winds up backing up fluid into the lungs. And this can present in respiratory problems, like they can't catch their breath. They may have what's called rales or crackles. It's really wet lung sounds. It's almost like they're blowing bubbles through a straw. It's kind of what it sounds like. Really, really wet lung sounds because they have all that extra fluid in there. When you have fluid in your lungs, you can't have gas exchange. Okay, so when you have too much fluid in your lungs, then you ultimately can't get enough oxygen into your body and get rid of the carbon dioxide. And that can lead to essentially suffocation, right? So congestive heart failure in an extreme is, it can be life-threatening, but people can live with CHF for a long, long time. They can take medications to help ease the load on the heart, and they can live a semi-normal life, if not a normal life, for a very long time. So that is chart 2. Again, I want you guys to understand, what the abbreviation is, what it means, but also like what exactly is it. So please make sure on your tests for this that everything is spelled properly. So the abbreviation needs to be spelled properly with uppercase and lowercase. And then also if you need to write what it stands for, like basal metabolic rate, if you were asked to spell that, you need to be able to spell basal correctly and metabolic correctly and rate correctly, so on and so forth. So be prepared on Monday to be able to do kind of a quick spelling bee. I like to do a spelling bee. Have everybody stand up and go around and make sure everybody can either spell the abbreviation or give what the abbreviation stands for. So if you have any questions, shoot me an email, send me a message on Remind, whatever works for you. My email is bartonj, BARTONJ, at dearbornschools.org.